Welcome. Thank you very much indeed. I'm Farhang Tahzib. I chair the Faculty Public Health Ethics Committee. I'm also involved in the UFA Ethics in Public Health section. I'd like to particularly welcome Sir Stephen Holgate, who's the Bazalgette Professor of Public Health, which is largely around getting research evidence into practice to this conversation. So Stephen, the legal case for Ella Kissi-Debrah is a significant, celebrated, landmark case. You, of course, played a significant role in its development of the evidence and working with legal colleagues in its submission and successfully defense in its court. I'm just wondering if you could briefly share with us your experience in developing the submission and defense of the case.
Thank you very much for having me give this little description of what I think is a major, as you say, landmark case linking air pollution to the death of a little girl. Those that haven't been familiar with this is a 9-year-old girl who died of very severe asthma in London. And the court case that came up was a second inquest called by the mother, who felt that there was something in the environment that led to this girl's sudden death. Obviously, totally and completely appalling, as all of us will appreciate as physicians. Now, I got involved in this when I read in the newspaper, actually, Rosamond Kissi-Debrah, Ella's mother, describing her daughter's experience over 2.5 years of nearly 27 hospital admissions of severe asthma. And I'd spent my life researching into air pollution, as well as other environmental and genetic causes of bronchial asthma. So when I read this, it rang lots of bells in my head about what the possible linkages might be. And it's through that pattern recognition, if I could use that description, that we made contact with the legal team, who at the time were representing Rosamond Kissi-Debrah in trying to find out what it was about the environment that may have triggered her daughter's untimely death.
So you actually contacted the legal team rather than them contacting you?
I can't remember. I think it was a combination of both, actually, because I think we met at a meeting and had a chat, you know, how it is. And then I think there was a formal approach then by the legal team. So that's how I got involved, yes.
And what was your experience in developing the submission and defense of the evidence?
Well, I spent my life researching asthma, and so I was quite familiar with the disease itself and the molecular and cellular mechanisms and how the environment could actually trigger very severe disease. But when I read about Ella's case, it really did seem quite extraordinary that a little girl aged 9 should have had these dramatic episodes of asthma. And of course, what that really led me to in discussion with the legal team was to try and get the hospital notes out, 6 different hospitals in London, and start pouring through the notes to try and see if we could find out what was going on. Now, the most amazing thing about this was that apart from the hospital records with all of the laboratory tests and the clinical descriptions, the most amazing thing was that very close to where this little girl lived was a government air pollution monitoring station. So we did have air pollution measures very close to Ella's home, which gave us the opportunity of matching these 2 pieces of evidence.
Did you actually give oral or written or both? Did you give oral evidence as well as, because obviously, I understand it took you 2 years to generate the evidence, am I right?
About 18 months to 2 years. I mean, going through these hospital notes, 2 huge boxes of information and going through every single thing to see if we could make sense of what had happened to this poor little girl.
And who funded you to do?
Oh, no, nobody. I did this voluntarily because, you know, I'm an academic and I'm just interested in getting to the truth.
I think that's an important point for public health people of our important work around gathering data. Did you also have to give, apart from your copious written research and evidence on this, did you also have to give an oral?
Yes, I turned up at court at Southwark Crown Court and gave evidence, and of course I was really asked about the scientific underpinning of my conclusions, which was that air pollution played a major role in not only initiating asthma in this little girl, but also leading to these terrible episodes.
What did your solicitor ask? Did you get any training or briefing from your solicitor about the sort of information you should share?
Oh, the solicitors are wonderful. I mean, the lawyers who dealt with this were professionals. And in my own field, I'm a professional. So bringing the two together, me on the medical and science side and them on the legal side, it meant we had really, really good conversations. And I have to say that they were not only involving myself and the legal team, but also Ella's mother as well, because she was key in all of this, because she was the one who really drove the linkage, I think, of bringing me into the story and getting me to try and unpick and unravel the complexity of this case.
Were there any surprises? The sort of advice you got from the legal team or things you had to do in court?
Not really. I suppose the thing that really happened as we started going through the case and I was getting questioned was a eureka moment for me, which may sound very strange, but this was a very complicated asthma case where mucus secretion and blockage of the bronchial tubes was the major cause of Ella's problem, rather than the bronchospasm, which is the usual cause of wheezing in children. And it was really putting together the mucus secretion side and the fact that her lungs filled up with this mucus in relation to the chemical irritation caused by the air pollution that really was the link that enabled us to come to the conclusions we did.
How did you explain those very detailed scientific details in court to a legal audience?
It wasn't as difficult as you might think, because having prepared the written statement, which was nearly 50 pages long by the time it had finished, I was sort of so familiar with the ins and outs of this, as well as the medical scientific literature around these different components that led up to Ella's death, that I was able then to put this into lay language, which I hope the lawyers who were obviously present at the case, as well as the public, could understand more clearly.
And what were your key learnings from this process, from experience? And what are the things perhaps you would have done differently?
Well, that's a very good question, and I often ask that now. So looking back, this is about a single human being. And I think thinking about this in the context of environmental exposures is very different from epidemiology or very different from undertaking experimental medicine. When you're looking at a single clinical case, it's a matter of creating a narrative that matched the actual underlying biological processes that I was able to uncover by going through in detail, like Great Ormond Street Hospital, access to the post-mortem histological material that came from Ella's lungs. And I was able to make a story that made sense. And I think at the end of the day, that's what all this is about, making sense of a very complicated set of interactions where a single narrative could actually have real meaning.
That's very, very interesting. And what would you have done different, perhaps? Because hopefully other public health leaders can learn from your initiative, firstly, taking on the case, doing the work voluntarily in 18 months of evidence, and finally, getting a narrative which was successful.
What would I have done different? I don't think I would have done anything differently, to be frank with you. I think it's a matter of looking at the clinical side of this as opposed to the epidemiological side of the air pollution asthma story. And I think taking a clinical lens, one is actually looking at the individual's response and pulling out strands of evidence across the 2.5 years that all connected together with these measurements that were made not only by the government air pollution monitoring, which I mentioned earlier, but also the local authority were doing their own monitoring in and around Ella's house quite independently. And all of that coming together in relation to the material I was able to uncover in these notes really helped make the case.
So what would your advice to the other public health professionals and public health leaders who are requested and want going to be working to develop submissions and to give evidence and their interactions with the legal system.
Yeah. Well, I think epidemiology is really important. But what we're talking about here are case studies, individual case studies. And I think finding an expert who actually understands the disease mechanisms within these case studies is the trick here. And of course, I spent 45 years researching asthma, so I really did understand a lot of the underlying mechanisms. And so when the opposition came with their questions, trying to sort of hit the ball into the long grass, so as to speak, I was able to actually resist that because I was confident about the science. So finding the right expert, I think, is the key here, really, and somebody who really can do the interdisciplinary observations that are needed, connecting the cellular and molecular science with the clinical story, and then with the epidemiology, which, of course, most of us as public health physicians are familiar with.
Public health colleagues listening to this, Stephen, would say public health is a population science, and you're referring to clinical evidence. So I'm just wondering, in terms of strategic litigation work, which involves populations and so on, what would your advice be for those people who are trying to develop strategic litigation cases, which doesn't involve individual cases, but whole populations and communities?
Yeah. Well, epidemiology is massively important in this area. And I can't sort of understate that, because it really is the driver of our knowledge across populations. But I think the important thing about epidemiology is to use different forms of epidemiology, not just a single methodological approach, but different approaches, such as longitudinal studies, cross-sectional studies, to bring them together to create a single narrative. I think it's the single narrative that's important here, not multiple messages, but single, understandable messages that the legal system can obviously deal with. And also to make sure that when one is doing this, you're translating it in a language that the legal profession and the public at large can clearly understand.
So Stephen, I think we are all indebted to you for the fantastic work you've done around this case, and we very much look forward to continuing to learn from you from this experience, so that public health people can work more with lawyers and use litigation as a tool to improve the public's health. Thank you very much indeed for your time, sir. Thank you.
Thank you very much. Thank you very much indeed.